and Assalamu alaikum, everyone. Welcome to the Medical Talk. Today, we have a very special guest with us, Dr. Josh McGough. Dr. Josh completed his medical school from the Stony Brook School of Medicine and did a 3-year accelerated MD program. Currently, he's working as an emergency medicine resident at Stony Brook Medicine. He posts a lot of medical mnemonics on Twitter. They're really helpful for students like myself for just learning all of the small information for step one exam day. So that's really helpful. I'm very honored to have him here today. Thank you so much for coming.
Yeah, happy to be here. Happy to help however I can.
Thank you. So I would like to start the conversation by talking a bit about your early life. So where were you born and raised, and what did your early education look like? How did you get into medicine?
Sure. So I'm from Rochester, New York, which when people think New York, they think big city. I was born closer to apple orchards. It was more of a rural area. And I didn't have anyone in my family that was ever in science or medicine, but that was something I gravitated to from a young age. I really enjoyed science and really enjoyed mathematics. It wasn't until my third year of college where I considered medicine, because at the time it seemed like something you could only get into if your parents were physicians or nurses or surgeons. And I never thought that was something accessible to me. Until later in my college career, I got a job as a scribe at a local hospital just to help pay for rent and bills as a college student. And that was really the point for me where I thought, man, this is the coolest thing ever. You get to take care of sick people, you get paid for it, and you're always learning in this position. So that was really when I caught the bug, was later in my college career.
So why did you get into a 3-year accelerated program? Because a normal program is very hard to get into and then you complete. So how did you get into a 3-year program?
Yeah, part of it, I think, in this whole process, it was luck. But the school that I ended up going to at Stony Brook, if you were already accepted as a normal 4-year medical student, they gave the option to apply into the 3-year program, which involved interviewing another 4 hours of interviews with that specific specialty. So I interviewed in for emergency medicine, and it was when the residency coordinators thought that I was a good fit for the program that I was accepted to the 3-year program. And at the time, it just seemed like I would save a year of education. And in the US, it's $80,000-$90,000 worth of student loans, let alone another year of attending salary. So financially, it seemed like such a wise decision, in addition to not having to worry about moving for the match process. I'm married, I have a 1-year-old, and moving across the country was not something that appealed to my wife or I. So the guarantee of the location was appealing as well.
So do you recommend the program to medical students?
Yeah, anyone who has an idea of what they want to do, I definitely would recommend it. If you're trying to decide between orthopedic surgery and psychiatry, I probably would not recommend it because you have to figure out what you want to do a little bit. But if you're dead set on a certain specialty within reason, I would definitely recommend it just from a practical standpoint. But since you would have to be a normal acceptance as a 4-year student first, worst case scenario, you're still a medical student. Even if you change your mind, you just wind up in the normal 4-year program.
What is the best way to rule out the specialties? Because obviously there are so many specialties and you get so confused when you're choosing one. So what is the best way to go about it?
For me, it began with, do I want to be inpatient or outpatient? And do I want to do surgery or not? I think that's a good place to begin. Personally, for me, I didn't like outpatient. I enjoyed the hospital. And within the hospital, I hated the operating theater. It is one of my least favorite places. You have to stand still. I have ADHD. I like to move around, and I never know what to do with my hands. That was just not the environment for me. But I really enjoyed the fast-paced acuity of emergency medicine, critical care, and I kind of narrowed in from there. So I would start broad, rule out some of the big branch points and fields, and kind of narrow down from there.
That's a good way to go about it. I think surgery and medicine, you should just start with that and then go. So what resources did you use in medical school to learn all of the information? And did you focus on the step one since the beginning of medical school?
Yeah, that's a good question. I am a big proponent of not reinventing the wheel. So things like UWorld, first aid, pathoma, for step one especially,
Yeah.
are vital. Other things, like some people prefer Sketchy, Picmonic. I preferred Sketchy. I use Boards and Beyond as well.
Yeah.
But beyond those things, if you find 2, 3 resources that really work for you, don't feel like you need to branch out beyond that. Because I found people that did all of those resources and UWorld and Amboss, and then they just were paralyzed with all the questions they couldn't finish.
Yeah.
But if you find 3, 4 resources that work for you and your grades are doing fine, I would just stick with that.
I think that's a good way to go about it. Just gets overwhelming when you use so many resources together. Talking about UWorld, so what is the best way to use UWorld when you're preparing for the step one exam? Because it's such a huge question bank. And do you use it as a learning resource or just a testing tool? How do you think is the best way to use it?
For step one, I definitely used it as a learning tool, less so for step two. For step one, you need to understand you're going to do your first 40 question block when you start studying for step one, and you are going to do awful. You're going to get 30% correct, maybe, right? Because you're going to forget all the minutia of glycolysis or what is this pathology slide, and that is okay. I feel like there's often a pressure to pump out 200 questions a day on UWorld just to feel like you did something, but it's much more fruitful if you do 80 questions a day, but you know you're not going to get those questions wrong a second time, right? What I tell medical students now is you should probably spend 3 to 4 more times studying a question than it takes to actually answer a question to make sure you're actually getting the most out of it, right? And that involves not only knowing what the correct answer is, but knowing why the 4 to 17 wrong answers are wrong, because that prepares you for not just that single question, but every other iteration of that question for future studying.
I think it's really important to look at the reasoning behind the wrong answers as well, as you mentioned, because that is how you will get the question right on the exam day.
Definitely.
Talking about step one, when you're done with step one, you obviously take the step two. So what are the best resources out there for step two exam?
I did a combination of UWorld and Amboss for step two. Amboss is a little more esoteric and a little more strange of questions. Some of their difficult questions are quite difficult, and I feel like that prepared me well. UWorld is more bread and butter questions, right? If you see a 4-week-old male with vomiting, it's pyloric stenosis. Like, you know the answer. You don't need to read the rest of the question, right? Amboss gives you a little more of those specific details. And beyond that, the resources are a little more subjective. Sketchy is, in my opinion, is less useful for step two than it was for step one. Boards and Beyond is still amazing. First aid is still amazing. But for myself, I had already done all of my clinical rotations before I took either step exam. So I relied more on the shelves that I had already studied for to already start more than halfway through for the step two studying.
Now that the step one is pass and fail and there's no score, so what do you think that IMGs as well as US medical graduates can do to differentiate themselves from all of the other applicants?
Yeah, IMGs, certain DO schools, and FMGs especially, certainly have more challenges because step one was a way they could differentiate themselves early.
Yeah.
I think now people are getting popular saying, just do more research, publish more things. In my opinion, if you have focused relationships with certain institutions, right? If you have a Nature paper, that's amazing. You're probably going to get somewhere. But if you have specific family members or relatives in a certain part of the United States, and then there's a local hospital system, if you're able to cultivate specific relationships, I would like to think that programs would be more amenable to IMGs based on relationships than other things like publications or doing really well on step two.
How do you think that those relationships can be developed?
I'm a big proponent of Twitter, just
Okay.
based off of like DMing people and getting advice. Like, I'm thinking about fellowships now that I'm a resident, and I've just been DMing people and getting insight from them. I think that's a good place to start. Certain places in the US are tricky because we still have a lot of COVID restrictions.
Yeah.
Places like New York, Connecticut, New Jersey, some parts of California are still pretty strict on away rotators coming in.
Um,
Other parts of the US that never really shut down to begin with, Florida, Texas, um, some rural parts in the Northeast, might be more easy for people to have away rotations if your school doesn't have a direct relationship with them. Other than that, if you have an alumni through LinkedIn that is an easy connect, I think
yeah.
for every 20 people you reach out to, at least 2 or 3 people are going to respond. And I would really just focus on those people who respond.
I think Twitter is a great place for medical students. I think Twitter is one of the best social media apps right now for medical students. So, talking about Twitter, how did you start your Twitter account and your journey towards posting so much about the step one exam? I found you through Twitter and I've been following you since the first year of my medical school. So, how did you get into Twitter?
Yeah. I didn't know you followed me. Thanks for following me. It was not intentional at all. I used to, as a first year medical student, whenever I got a question wrong on a test
Yeah,
or a flashcard wrong on Anki, I would write it down.
yeah,
And then a week before an exam, I would condense 30 or so pages of notes into 3 pages of notes. And I would take those condensed pages and know all the questions I got wrong so
yeah.
that I wouldn't get it wrong on the test. And I realized this is a colossal waste of paper. So I just started tweeting all of these things to no one. It was just to myself because these were dumb memory devices I used to get the questions right. And then some of them just got a lot of traction. And here I am a couple years later. None of it was intentional. But I'm happy to think that I got a couple points for other people on test day at this point.
Your memory devices are really helpful. Talking about Twitter and LinkedIn, what do you think is the importance of a social media presence in the current day and age for doctors?
So I'll answer this question 2 different ways. As a student and a trainee, I think it's important because it gives people another way to remember you other than like your ERAS photo and your CV. If they have some insight into your personality, right? Are they going to want to be on a shift with you? Are they going to want to deal with a difficult patient or a code with you? I think you can get some of that with just person to person conversations on Twitter or whatever social media. I think it's incredibly useful. The second way I'll answer that, though, is as a professional, at least in the United States, and I'm assuming abroad, it is rampant with misinformation. And people spreading misinformation have gotten very good at it in recent years. And physicians and health professionals, we've been so locked into our own silos of professionals, we haven't really been practicing that. So from like a public health standpoint, I think it's important to be able to communicate things in 260 characters or in layman's terms, just to spread proper information to patients as well. And I think that translates to the bedside, right? So I'm in the emergency department. And if someone walks in and says, you need a laparoscopic cholecystectomy, the patient has no idea what you're talking about, right? So you need to be able to explain things in ways patients understand. Um, and I think both of those are useful skills and will never not be useful skills going forward.
I think you just need to be mindful while using Twitter and other social media as well, spreading the right information. Talking about residency and program directors, what qualities do you think that program directors look for in the match applicants?
It's tough, emergency medicine is so different than psychiatry is different from pathology. But for emergency medicine specifically, we are a pretty, I would think, personality based specialty, right? Before your ability to know statistics and run some randomized double blind clinical trial, I would think they would want to know, can you talk to patients? Can you build rapport quickly? And do you have an interest in some kind of niche potentially, right? Be it toxicology or simulation, ultrasound, whatever. So emergency medicine broadly is based off personality, I would think. Other specialties, it might be more based off of the scores or research prowess or things like that. But I think less so of what I think program directors would want. Talking about social media, you can just ask what they want, right? Then you don't have to assume I know what I'm talking about. You can just get it from someone who definitely knows what they want.
Yeah. Medical students face a lot of burnout, especially during the step one exams and with residency and medical school exams as well. So, how do you think
Mhm.
that they can tackle this burnout and find a better work life balance?
I'll let you know when I figure that out. So, on the topic of burnout, I will say the conversation is usually how to never burn out, how to avoid burnout.
Yeah.
And in my opinion, it's not a matter of if, it's more a matter of when, right? Burnout will happen inevitably to all of us, regardless of how many vegetables you eat, how much sleep you get, like how big your support network is. It will happen. I think it's a skill to notice when you're starting to burn out and
Yeah.
have the ability to reach out before it can be at the detriment of your education or the detriment of your patients. For me personally, I'm a pretty easygoing guy, but if I start becoming irritable, that's a burnout problem, right? And I have people, close friends, my wife, that will tell me that I'm starting to behave this way. And then it's that point where you need to be more proactive,
Mhm.
right? So for me, it would be I get way too involved with studying to get
Mhm.
3% more on a test, or I'm getting way too involved in multiple research projects, or I'm trying to overextend myself in some way. I worked part time in medical school, and that was a big stressor for me. Um, so I would start with not judging yourself if you're feeling the issues of burnout, knowing that happens with everyone, and just have the people outside yourself that you trust to get that feedback from. So
Yeah.
it takes a lot of the guesswork out of the student themselves.
I think you just need to recognize that point and stop yourself right there and reevaluate. What is your advice to residents regarding their first year at the hospital? What are your suggestions for them?
Oh, you know, uh, uh, at at first, just rely on the nurses and trust the heck out of these nurses. I have nurses that I work with that have been working at this specific hospital longer than I've been alive, right? So relying on people who know more than you and
Yeah.
trying to be humble, right? I feel like when you graduate medical school, you think you're at the top of some food chain, but to
Mm.
just realize that you have so much you can learn from so many people. Um, we have like a custodian at my hospital that everyone knows, right? The chief, when the chief was an intern, the custodian was still there. So just relying on people outside yourselves and being humble is a great place to start. But beyond that, knowing that similar to the first year of medical school, there's going to be so many resources, ways to study, ways to get better at things, research projects, but being able to just slow down and say, I have one priority today. I'm going to get slightly better at EKGs, or I'm not going to mess up an antibiotic order. And just doing one thing a little more correct every day has this massive cumulative effects over the 3 to 7+ years of residency and fellowship. And I would focus more on that slow growth rather than trying to accomplish everything immediately in residency.
That's great advice. I think you should just focus on getting better every day and then you will get somewhere by the end of your training. How do you see medical education 50 years from now?
Oh, that's a very exciting question. And thank you for asking it. I would like to think 50 years from now, we're going to realize that medical students, 90% of the time, I'll say, care much less about how their specific school teaches heart block
Yeah.
or strokes or pick any topic. And we'll realize that there are 5 resources that we mentioned already:
Yeah.
Sketchy, Boards and Beyond, UWorld, whatever. And those are the best,
Yes.
right? I've never heard of anyone ever say, I got a 270 on step 2 because I had a great professor. No one ever says that, right?
Mhm.
They all say, I did this specific thing from these outside resources, right? And that's what made the difference. I would like to think 50 years from now, schools embrace that, go full force on those resources. And
Mhm.
then the things that differentiate them are specific departments, specific faculty, specific research things,
Yeah.
instead of playing this current game of we have our in house lectures that med students kind of deal with, and
Yeah.
then they spend all their time outside that, right? I think it's wholly inefficient the way it is now. And
Mhm.
I think the early residents and young attendings are starting to take note of that, and I
Mhm.
would like to think it's a completely different system going forward.
I really hope that happens too because I'm a second year medical student right now. And I really feel that it's high time that we realize, our medical schools realize that it's all right if we don't learn from our lectures and learn from other resources that are better in explaining things. And they have more visual content that we remember better rather than just sitting in the lectures and learning information passively. So, yeah,
Mhm.
I really hope that happens soon. Thank you so much for coming and taking out time for this interview. It was an honor having a conversation with you. I have been following you on Twitter for a very long time. And I've been reading all of your tweets, and it's an honor having you here today.
Yeah, thanks for having me. If anyone has any questions or ways that I can help, I feel like I was just a medical student literally a couple months ago, so I know how it is. So feel free to have people reach out to me, whatever you need. I'm happy to help.
Thank you so much.